I think I'm happy than my grandfather. 1 century years ago, my grandfather from China take the ship, take the 2 months from China to here. So I'm very happy. It's my pleasure to hear. I take the short time to introduce my university. My university is called Nanjing Medical University. Nanjing is the capital of the Jiangsu province. Jiangsu province is very close to Shanghai. It's the least south part in China. In my university was established in 1934. Right now it's the Nanjing Medical University. We have 2 campuses. One campus in the center of the city. Another is more than 10 times the older campus. We have the student total more than 17,000. We have the more than 1,000 staff and faculty. Right now we have the 23 school and department, include the School of the Stomatology. In China, we call it stomatology. In America, the dental school. Yeah, that's the difference. Because in my dental school, we teach some students the oral-facial surgery. Yeah. We have the 23 affiliated hospital, include the stomatology hospital. We have a different education system. Right now, in university, I charge of the education. In the stomatology, right now in China, is the top 6. Yeah, we have the different terms looked the clinical medicine ranked the 5, 7, 9. Today, I'll give you the lecture about the microRNA bind site the SNPs of the FGF genes and the risk of the non-surgical oral-facial cleft in China the population. I know here so many dentists, many staff for us to talk about the genes. You know, in human gestation is the 6 and 12. If some factors influence the 6 crest fusion, maybe can result the craniofacial cleft. In this cleft, the more is the lip cleft and lip of the palate. The incidence right now in the world about the 1 and 2 per 1,000. That's the different from the Asia more than Caucasian and Africa. In China, right now is the 1.8 per 1,000. You know, in somebody so from the lift of the cleft, maybe get so many trouble for the baby and for the family. There are 2 kinds of oral-facial cleft. One is the syndrome oral cleft. Another is the non-syndrome oral cleft. This kind is associated another congenital anomalies. Another one is the without any major birth defects. Right now, we just focus on the non-syndrome oral cleft. So many factors influence this cleft. 2 kinds of environment and the genetic factor. This time I will talk about the SNP. Yeah, microRNA bind site SNPs. Yeah, this microbind site SNPs can affect the interaction between the microRNA and RNA and microRNA. Then modify the gene express. All kinds of the disease, include the orofacial cleft LISIC, is related with the snaps. Right now, we think about if microRNA bind the SINT snaps and FGF genes contribute to the resect of the non-syndromic orofacial clefts. We follow the list steps, then researched of the list steps with the cleft. The first, with selection of the genes and the snaps. FGF genetic selection. There are 22 FGF genes were identified. Another snap selection, we used 3 in silicosators. 11 snaps in the agents were identified. We collected the sample from 4 areas of the jurisprudence. 602 cases, and another is more than 6 control. We use the DNA extraction and the gene type. List the DNA extraction, gene typing. We find 3 snaps with the cleft in China human population. Associated between the 11 snaps and non-syndromic orofacial LISIC. Yeah, this is 3 eyes, 3 sevens, 3, 6, and another 2 snaps with the non-syndrome oral cleft in China. Then we research the snaps function. Yeah, significant difference between the plasmid with the different early snaps when transfected with the microRNA. Snaps affect the gene express, the different expression. From the list result, we got the conclusion. Our study found the 3 snaps of the FGF2 are IS10480201, FGF5 and FGF9 were associated with the non-syndromic oral cleft LISIC in the Chinese population, probably by affecting microRNA and mRNA interaction and gene express. Results published in different journals, include Natural Communication in 2015. This is my paper published in Natural Communications. Yeah, we have the team to do this kind of research. Thank you.
Thank you, Doctor. We have a couple of questions. Let's wait for the microphone. Dr. Tolarava.
Very nice study. Congratulations.
Yeah. Thank you.
I have 2 questions. Cleft lip and palate, this is what I live on for 50 years. So did you see differences in these SNPs if you look at subclinical types, or at least if you look at cleft lip only and cleft palate only?
Mm-hmm.
Did you see any differences? That's my first question. And my second is, how many of those from 600 cases were cases with first-degree relatives affected as well?
Yeah. Right now, in my research sample, we didn't divide to the lip cleft and cleft and lip. We correct to research. Yeah. Pardon the second question?
Did you look differently for cases with a family history in first-degree relatives and those without, were sporadic cases?
In my study, I didn't divide the family control, just a single child. Well,
So that would be interesting to look.
yeah, in future maybe we collect the family sample. It's very difficult to collect the big family. Yeah, thank you. Yeah.
Dr. Tola?
These S&Ps, did they increase translation or decrease FGF expression?
Pardon?
With these S&Ps in place, the expression of FGF was increased or decreased?
Yeah. Right now, FGF is just only one of the factors. Maybe so many factors influence the. Yeah, so many factors influence the cleft lip and cleft lip, lip cleft. Yeah, so many factors. Yeah.